Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 19, 2025. This video is in a Nature Reviews cardiology article published this year titled Novel Pharmacological Approaches to Lowering Blood Pressure and Managing Hypertension. Why is hypertension often underdiagnosed? Over 50% of individuals are unaware due to asymptomatic presentation and inadequate screening. What is the gold standard for blood pressure measurement? The auscultatory method with mercury-free sphygmomanometer. What are white coat and masked hypertension? White coat hypertension, elevated in clinic but normal at home. Masked, normal in clinic but high at home. What is treatment-resistant hypertension? Blood pressure is greater than 130 by 80 millimeters of mercury, despite lifestyle measures, and 3 drug classes, including diuretics. Rationale and poor control. How much benefit does lowering blood pressure provide? A 5 millimeter mercury reduction provides about 10% lower major cardiovascular event risk. What role does genetics play? 120 and more loci affect blood pressure and drug response. Example, renin-related differences. Why are lifestyle changes crucial? Exercise, sodium reduction, weight loss, lower blood pressure. Though adherence is challenging. What is therapeutic inertia? Failure to initiate or adjust therapy despite elevated blood pressure. How does adherence affect blood pressure control? 25% never start medications. Only 50% of resistant hypertension patients adhere after 1 year. Novel pharmacological approaches. What is the advantage of single pill combinations? Improve adherence, reduce inertia, lower blood pressure more effectively than does dose escalation. What are quad pills? 4 low-dose drugs combined, outform monotherapy without extra side effects. What are small interfering RNAs in hypertension? Zilebesiran silences angiotensinogen, lowering blood pressure up to 24 by 11 millimeters of mercury with 6-month dosing. I did an earlier podcast on this medication. What about antisense oligonucleotides, ASOs? Ionis AGT LRX reduces angiotensinogen but has not shown to be consistent with blood pressure lowering. How do aldosterone synthase inhibitors work? They block CYP11B2, preventing aldosterone escape and lowering blood pressure by around 13 to 20 millimeters of mercury. What are non-steroidal MRAs? Newer agents like osidurenone improve adherence and have fewer off-target effects. How do neprilysin inhibitors help? Sacubitril valsartan lower blood pressure more than enalapril. And now first line in heart failure with hypertension. What role do endothelin receptor antagonists play? Aprocitentan, FDA approved 2024, lowers blood pressure around 15 millimeters of mercury, but there's a risk of edema and teratogenicity. Or phosphodiesterase inhibitors, 5 inhibitors useful? Through vasodilators, no recent hypertension trials exist. Why are novel therapies still needed? Global control remains less than 25%, especially in lower and middle income countries. Which new approach is closest to practice? Aprocitentan is FDA approved, small interfering RNA, and aldosterone synthase inhibitors are advancing in phase 2, phase 3 trials. More in this Nature Reviews article. I encourage all of you to read it. Eponyms in hypertension, Korotkov sounds, heard during blood pressure measurements. Every medical student knows this, named after Nikolai Korotkov. Cushing's reflex, which is hypertension plus bradycardia and irregular respiration, described by Harvey Cushing. Conn syndrome, primary hyperaldosteronism due to adrenal edema, Jerome Conn. Pickering syndrome, malignant hypertension with renal failure, George Pickering from England. Little syndrome, genetic hypertension from overactive epithelial sodium channel, Grant Little described it. Gordon syndrome, familial hypertension with hyperkalemia, Richard Gordon described it. Yanagasawa peptide endothelin 1 or endothelin 1, discovered by Masashi Yanagasawa, led to endothelin antagonist. So, to remind y'all, white coat hypertension, elevated blood pressure in clinic, but normal at home. Masked hypertension, normal in clinic, but elevated outside clinic. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.